Good morning, everyone. This is Jim Paschulitis. Get Pash On It. I hope everyone's doing well. Today, we're going to be talking about a topic that really affects millions of people throughout the country. And to join me for this conversation is Bryce Pritchard, a friend of mine. We worked together at our agency at Empower, and now he is a co-founder of Retirees Agency, LLC, and has moved away from the wonderful warm weather of New York to be down in Carolina. So here's Bryce. Hey, bud, how are you?
Ash, thanks for the warm welcome.
Oh, you're welcome. How is it down there?
It's sunny and probably about 70 right now, so I'm loving life.
And where exactly are you?
I'm in Winston-Salem, North Carolina.
Okay.
So
yeah, I've been there before.
Yep, made the move back in August, and it's been a good move so far. So I've been happy.
Oh, awesome! And we're coming off. I guess we don't need to timestamp it, but we're just a couple days after Easter. How was your weekend?
It was a good weekend. I don't have much family down here, but I do live with a friend of mine from back home in New York, and his family lives down here. So we went over there on Sunday and spent the day with them, had a good ham dinner and all the good Easter food. I'm sure you know about all that, but it was good. It was relaxing, and watched a little bit of golf and the Yankees game. And it was good. No complaints. So how about you?
Yeah, same. Actually, not to get too historical, but I'm Greek Orthodox. My wife is Catholic. So we're a mess. No, just kidding. But both Easters, so the Easters don't always line up. And this year, both Easters were on the same Sunday. So
very nice.
Both cool. Christian, same beliefs. It's just different calendar. So
yep.
Yeah, it was good. We were running around from one family to the other and, nice. Sharing. So
yep, very cool.
Very cool.
All right, so different to be away from the family, but
yeah.
No.
But you're back in care, but you're in a place. I think I was excited for you. I'm sure your family is. Your parents probably like big fans of yours and also nervous for you and all that. So, no, it's very exciting stuff, and you guys are doing great things. We'll have some plug, your website and all that on the description after. Cool. So. Now let's get into the topic that people are here about. We're going to be talking about something called a dual special needs plan. We use the initials D-SNP is what we call it in our world. I think sometimes we use it and we don't realize the person's like, what are you talking about?
For sure.
So why don't you start by just explaining what is a D-SNP, dual special needs plan?
Yeah, so a D-SNP plan is when you have both Medicare Part A and Part B. That's your original Medicare, the red, white, and blue card that you get in the mail when you turn 65. So you have to have that first of all. So I kind of refer to that as almost like your, like your ticket to get into the show. You need this before you can get anything else. But kind of to sum it up, a dual special needs plan, you need both Medicare and Medicaid, and it combines the two. It combines the coverage and kind of helps you take care of some of your or most of your healthcare costs. With the Medicaid, they help kind of cost share between the two plans, and it gives you some very, very strong coverage.
That's a great explanation, and I'm going to break it down a little bit more because I get this all the time. What is Medicare and what is Medicaid? So in a very quick surface level, Medicare is a federal program, and there's rules to that. Medicaid is state or county run, and it is income related. So there's a threshold of what you can earn. If you're below that threshold, you get Medicaid. So you need to have both eligibilities. And, most people think of it, it's 65-year-olds only.
Yep.
Typically, yes, being 65 years old is one way that you can get into Medicare. There are others. So regardless of age, having Medicare and Medicaid allows you to be considered for what we're about to talk about today, dual special needs. And now another quick note, this is the marketing ploy that companies use, right, as well. Not that this is what today's episode is about, but they'll send you cards that talk about the benefits that come with these plans, and it's really, you're not even eligible, and they just want you to call them. So be careful. And now we're going to learn whether or not you're eligible, and you should pay attention to any of those.
Very, very good point. I mean, you wouldn't be surprised. I'm sure you've gotten the phone calls before, but I do get a lot of calls with, people saying, hey, my aunt or my uncle has a $200 a month, or, some or whatever it is, to spend on groceries every month. And you always have to just remind them that that's not for everybody. And depending on your eligibility. So I always like to tell people, just be careful of that, because you will see commercials, you will get mail, you will get phone calls of people saying, oh, you might be eligible. But most of the time, if it sounds a little bit too good to be true, it might be. So just be aware of that.
Yeah,
but
be careful.
Question. What was your question?
No, that was all we were talking about. Like, so make sure we know about duals and what Medicare and Medicaid. So we're good there. Mm-hmm. So, and I think you kind of answered question number 2 for me already with the description. To qualify, you need A and B.
Yep.
And you have to have either full or partial Medicaid. I don't know if we need to delve too much into that. A lot of people think of Medicaid as only one thing, like you either have it or not, but there are
different levels. Yep.
And that could make a difference which of the D-SNP plans you could have. And I don't know that we want to go into the minutia of that, but you need to have A level.
Yep.
You go with that?
Sure. Yeah. I don't think getting into the numbers, it makes too much sense, but
but it's basically based on income, right? So if you're below the lowest income, you have full Medicaid, but then some of the states have this portion where you have a little bit more income.
Yep.
They give you a little more leniency and you get some support.
Exactly.
Okay. Yep. All right. So here's a question that comes from a lot of my clients, and you probably have seen as well. Does enrolling in the D-SNP, so let's say you had Medicaid for all these years, and all of a sudden you're getting Medicare on it, and you're like, oh, why do I need it? I'm doing great. Do I lose Medicaid by enrolling in a D-SNP?
Great question. The answer is no. Simple answer is no. You do not lose your Medicaid. Medicare and Medicaid just work together. And Medicaid kind of helps manage your benefits a little bit better. Like I had mentioned, they help with the cost share a little bit and help with co-payments, co-insurance, and all of that. But you don't lose Medicaid by joining a Medicare plan. Again, they just combine benefits and make your coverage a little bit stronger.
And coordinated, I think, is
coordinated.
What we use, right?
Yep.
All right. On that note, I was thinking as you were talking, what is the cost typically for a D-SNP?
Yeah, so for most plans, they'll have a $0 premium. So as long as you have both Medicare and Medicaid, usually most of these plans come at $0. That's not speaking for all of them, but most of the times you will find them with zero premium. Yeah,
that's premium free at the time. And there's a lot of intricacies that we could describe about how that payment, if there was a premium, how it could get covered. But in general, for the beneficiary, the person we're talking to, it ends up being no additional premium.
Correct. Yep.
Long story short. Okay.
Exactly.
We are doing an information series here, and so we're not allowed legally to talk about like specific benefits. Mm-hmm. So without doing that, what kinds of categories do their benefits help someone who may have had Medicaid? Like, well, what does a D-SNP do, and what categories do you think they add?
So, like, are you kind of asking what types of things these D-SNP plans offer as far as?
Yeah, like I'll give you like an example. Is there dental, vision, hearing, kind of stuff in these plans?
Yeah, so most of the times you'll find a D-SNP plan, they'll have the dental, vision, and the hearing, coverage, and sometimes you'll see them giving you an allowance towards those categories as well, depending on the plan and what area that you live in. But the dental, vision, the hearing, sometimes you'll see them giving gym membership benefit, or what else I'm trying to think of.
Over
the counter allowance, so an X amount of money to spend every month on over the counter products or healthy foods. And then you'll see some of them also have transportation built right into them too, so they'll actually help you. Depending on a certain amount of transportation rides every month. but they will help you get to and from doctor's appointments, hospital visits, whatever you do need help with. So, which is awesome for a lot of people, because it's not everyone does have a car to get around, and people that do, you might not be able to drive as much as you used to, or as much as you'd like to. So it definitely helps. I see a lot of people, oh, does this plan have transportation? And it's always something that I look at if it is important to the person, because not everyone has a son or a daughter or a grandchild around to take them to their appointments, which I personally think is very important. You need your health care, and you got to take care of yourself, and not having a ride there isn't something that somebody should have to deal with, So, but yes, these plans do have a lot of extra benefits built right into them, which help a lot of folks out.
Right. And to learn about those benefits, just see your local broker.
That's right. That's right.
Shameless plug. There you go. All right. So does a person can they keep their doctor, or do they have to change their doctor once they go from what they had?
Yeah, great question. Another great question. Lots of good questions here, Pash.
What I do.
So something that I always do, and I know you do it as well, but when you're checking out all of these plans, you want to make sure that your doctor or hospital network is in network with the plan. So there's two different types of plans. You have your HMO and you have your PPOs. The HMO, you have to stay in network, and the PPO, you have a little bit more flexibility to see doctors and hospitals that you like. But the answer is yes. I mean, you do get to keep your doctor, but just make sure that your doctor is in network with the specific plan that you're looking at.
Yeah, I think the correct, it depends is how I would probably phrase it. Because it depends on the scenario. If you had Medicare and then you gain Medicaid, you may have a challenge. If you had Medicaid and now you're going to get Medicare, it may be less of a challenge, because the hard part, at least in New York State, is the providers have to accept both, right? They have to be able to do both. So it can be a challenge. You might be able to keep your doctor, but you might have to be aware that you need to consider another doctor. That's where the broker investigation helps.
Yes. And that's something that I've even had to learn on my own. Just when I first got started, I would enroll people into a specific D-SNP or dual special needs plan. And I got a call and hey, my dentist doesn't accept this insurance. I see it with dentists a lot specifically.
The most.
Yes. Correct. So I did my due diligence. I called the dentist. Hey, do you guys take blah, blah, blah health plan? Yeah, we accept them, but they didn't end up accepting the Medicaid. And the beneficiary had some cost shares with that dentist. And, I felt bad because I didn't do my job as well as I should have, but it was a learning curve for me, and I know that now. So always just make sure for anyone that is watching this, make sure that your doctor, hospital, dentist, whatever, make sure that they accept the Medicaid, because they might accept the regular carrier Advantage plan, but they might not accept the Medicaid.
That's a great point. That's a 100% great point. And it's an error or an experience that sometimes it's not till a broker actually makes the error that they learn it. But I promise you won't be doing that again. All right.
For sure.
Like the exact name. You don't just say the carrier, you say, this is the plan I'm talking about. Exactly. You might even give them the CMS code now. Yeah. This is the one I want you to look up. So,
and to kind of piggyback off of that, just because you have Medicaid, everything, when you're going over the summary of benefits with a broker like yourself or myself, and everything you're going to see down the line when you're going through most plans, you have $0 co-payments and things for certain services. But that doesn't just mean that you can go into any dentist or hospital and get any service that you can possibly think of. You can't go in and get a new set of teeth, or, get this done, get that done, because you're going to be sharing some costs. So I have ran into that before too, where they go get a service, but it was something that isn't actually covered by Medicare, and then they're left with a bill, and it's where do you go from here? And again, it's a learning process for everybody, and but just be aware of those things as well. Is just because you have Medicaid, every service that you want is not free.
Right. And again, I think the dental is where I've seen the most. That's where I do most of my work. Most of my questions, if I get them, are about the dental. So dentists have different rules than doctors. Their dentists here, they don't take any insurance. They actually have the option to do that. So, and they're still busy. So, all right. How about the prescription drug coverage? Do these D-SNPs include prescription drug coverage?
Yeah. So, short answer is yes. Most of these plans do have the prescription drug coverage built right into them. And I don't want to complicate things too much, but for most prescriptions, you won't be paying more than a couple bucks for, even if it is a very expensive medication. If it's covered on the drugs formulary, you won't be spending more than a couple bucks for your medications, but it does have the drug coverage built right into the plan for most of the plans. Yeah.
And as a broker, really, that's our only real assignment on these dual special needs plans is, does that medicine show up on the carrier's formulary? Exactly. That's really all we got to do.
100%.
All right, awesome. All right. Can I enroll in these plans, the D-SNPs, at any time?
Yeah. So sometimes throughout the year, if speaking outside of that annual election period that I'm sure everyone has heard about from October 15th to December 7th. Yeah. Yep. So besides from that, there are special election periods that will pop up throughout the year. And it can be for multiple different reasons, natural disasters, this, that. But sometimes they will pop up throughout the year, and they're always state specific. So if you have a friend that just switched to a plan in last month and they're from North Carolina, for example, it doesn't mean that special election period is available to you in New York. So the answer is yes. There are times too that you are able to enroll outside of the annual election period, but it really is going to be state specific and depending on if they have an active special election period going on at that time.
And not to geek out too much, but losing and gaining Medicaid happens all the time. So I have several clients where, unfortunately, they get this thing called a recertification letter notification. Make sure you call us to update your income to evaluate if you still should have Medicaid. Well, sometimes they don't do that, and then they will lose Medicaid.
Yep.
That means they can't have these dual plans anymore. So then they have to get a standard Medicare Advantage plan. But the other way around happens too. I have clients who gain Medicaid all of a sudden, and now they have the right to a dual special needs plan. So that gives you an enrollment opportunity outside. That's one of those special election periods you were talking about, outside of the AEP, which is from October to December.
Great point there.
So that's, again, people are not always aware of that. They don't even understand what happens. So when you have a trusted broker like us, one of the assignments as a former teacher, I give a lot of homework assignments to my clients. I say, bring any paperwork you get, because they're bombarded. We are all bombarded with mail. And as we get older, and even when we're whatever age, it's hard to understand what's real and what's not and what they mean. So we are able to help decipher that for individuals. So I'll have them literally bring in their mail, and we'll say, let's understand what it says. And then if it's a recertification letter, I've assisted them to get that phone call made or go to the office, Department of Social Services, and go get that updated. And then they have it, and now we have an enrollment period and blah, blah, blah.
Yep. Perfect.
Cool. All right. And there's several. In most markets, there's more than one of these plans. How can a person help sort through what might be right for them? They're like, look, I got both Medicare and Medicaid. How do I figure out which one's right for me?
Yeah. So personally, I think that the best way to go about all of this is using a broker like myself or you, just because we do have access and we do offer multiple different carriers. And at the end of the day, we can sit down and go through the client's own specific needs, whatever they are, go over their prescriptions, go over what's important to them in their healthcare, and really break down and look at all of the different plans and see which option is going to best fit them, make sure that their doctors and their hospitals are in network, make sure that their drugs are covered on the formulary. So I think sitting down with somebody that has the knowledge and the looks at these plans every day is the best way to go about it. And maybe I'm a little bit biased, but I do think that sitting down with somebody is the best way to go about it, just because we do have access and we'll be able to really break it down and get you well taken care of.
Personal story alert here. I'm here with you today because about 5 years ago, maybe in 6 now, I was a teacher, and my parents got divorced, and we had to figure out my father's Medicare and Medicaid health insurance. And even though I had a master's degree, I had no clue what was going on. I was frustrated and scared to make some mistakes. I ended up calling a friend of mine, Hector Dessus, and he lived in Arizona, and he did everything that you're talking about as a broker from a distance. He helped us sort through this nonsense, and I call it nonsense because it's so confusing.
Yeah.
And it was so helpful. I mean, he did it all. He knew statuses and all that, and he just helped us do it. So I was grateful, and I was so impressed, and I really, saw the fulfillment he was getting, and I was like so magnetized to that. How can we help people? How can I do that? And that's how I'm here today.
Yep.
There is as you were talking, the conversation that kind of happened and popped in my head was, people know about some plans. In fact, a lot of times they know the one that has the largest benefit, especially OTC side. Yep. They're like, I know I have Medicare, I know I have Medicaid, I should qualify for that.
Mm-hmm.
But this is where our knowledge comes in. There are different levels, like we talked earlier, of Medicaid. So some of these plans are designed for only the absolute full level of Medicaid. So you can't have it, but you would not know that. For sure. Another person may inadvertently give you that information, or maybe like consciously give you wrong information to get you to sit with them, and then you end up with something that's far less anyway. So there's a lot of minutia to it. There's a lot more. We're making it sound so smooth and easy. It's something to traverse together, and when you have a broker that you trust, they're in this journey with you lifetime. It's not just for a 5-second thing. Yeah. So. Yeah.
And I'll just to kind of add on to that, there's a lot of people that I'm sure you've talked to, I've talked to, anyone else that does this as a job. You get people all the time that come in and just kind of want to explore different options. And when you do sit down with them and really do a full needs analysis with the client, it's crazy what you'll kind of come up with, and some of the different exposures in their plan that is something that might be important to them. But it just sitting down with someone and making sure that you're on the right plan is really you can't beat it. It's something that's important to a lot of people. And that's part of the reason why I enjoy doing what I do, and what I'm sure you same for you. And it's a great feeling when someone comes in and they have a plan that really isn't tailored to their own needs, and you get them set up with the one that they are and that is, and you both leave there happy, knowing that you help someone and you got them coverage that's going to suit them a little bit better, and they're dancing away because they got some new benefits or lower co-payments or so it's awesome.
I totally agree. I literally just had a client who came in. He's panicking, just lost his Medicaid. And it's an emotional thing. It's not just a number. It's a human being who's like, what am I going to do? How am I going to pay for that medicine now? And we'll do the due diligence and look for prescription drug assistance wherever we can. But they're not alone, and it's a journey. Well, I always kind of say it this way. We're going to try and find what's right. I'm going to help you learn about things and help you, the client, decide for yourself what do you think is best for you now. But it's just for now. Like life changes, doctors change, right? So same thing with our Medicaid statuses. They change, and we're here to help. So
just because you're on a plan now doesn't mean that you'll be on that same plan next year. Well, we'll always reevaluate and.
Yeah, and as brokers, we're not married to the carrier you go to anyway.
Exactly. That's why we work for the client.
Yes.
Yep.
And I appreciate your time today, Bryce.
Yeah, of course. Thank you.
Really appreciate you coming in,
Yeah.
and I thought it was very informative. I'm sure this will not be your last visit if you'll
not.
be nice enough
Yeah,
to
no,
come
I
back here.
appreciate you having me on, man.
Yeah.
It was fun. So
Yeah.
thank you.
Oh, you're very welcome. So to everyone who watched this, hopefully it was informative. Share this information. Like, I always get these wrong. Like,
comment,
share,
and subscribe.
and subscribe. You guys, you youngins, you guys get it every time. So if you have these questions or more, why try and figure them out yourself? Just get Pash on it.